It's Friday, so it must be time for another legislative briefing from the North Carolina Medical Society. Happy that you joined us this week because we've had a good week. We've had two major bills either pass this week or come to a resolution this week that we've been working on for a long time. The first is the North Carolina budget. It's a $21 billion budget. Was approved in the middle of the night last night at 1 a.m. by the House. It was the final vote necessary to go to the governor for signature. This is a good budget for us. It doesn't hurt us. There are not any rate cuts in there. It actually has a robust health information exchange provision, which fulfills the data provision that we've been asking you to call legislators on for the last few weeks to ensure that you're going to be able to get the clinical data to be able to take care of your Medicaid patients on a go-forward basis. That provision also includes a healthy sum of money, $8 million recurring, that will be matched by the federal government to put $16 million towards taking care of operations and development and ongoing continuation of the HIE, with keeping your contribution to the HIE at a very bare bones minimum, a small receipt fund to keep the HIE running, instead of you having to pay for the full freight of making sure that the clinical data that you need is freely exchanged between your peers, between other facilities and other healthcare providers in Medicaid. So that's a great positive. A couple of other things in there that we're on the watch for to see exactly how they're going to be implemented. One of those things is a requirement for the utilization of the CSRS, which is already something that we have encouraged you to sign up. The CSRS is the Controlled Substance Reporting System. This is a way for you to understand what opioids and controlled substances your patients are getting prescriptions for, so that when they come in and ask you for something due to pain that they're feeling, you can know whether they've already gotten a prescription, and you can help take care of them better and make sure that they're not seeking pain medicines that they don't need. In addition to the utilization of the CSRS, there is a new requirement to receive CME in order to prescribe controlled substances. And so we'll be looking in the future about what the regulations are that develop from that, working with the medical board on how that gets implemented, and be bringing you much more information about that. But overall, the good takeaway is that this budget does not hurt medicine. It doesn't cut rates. It actually helps us with clinical data in the future and is a good stepping stone towards Medicaid reform. So we're appreciative of it. The second thing that worked out this week was Medicaid reform was announced. This is the deal between the conferees for the House and the Senate. It is going to be the hybrid solution that we have been talking about for the last few weeks. So included in the things that will be capitated for 3 statewide entities and up to 10 regional entities will be all physical medicine, labs, prescription drugs, and long-term care or skilled nursing. Excluded or carved out for now is all behavioral and mental health, dental services, and the dual eligibles. We expect that the timeline for Medicaid will be 9 months to get the application in, however long it takes for CMS to approve it, we think 12 to 18 months, and then the bill allows for 18 months after CMS approval before anybody's required to be in these new contracts. So it's going to be 3 or 4 years, at least 2 more sessions that we're going to be working with legislators about the details. This bill is really just the general framework. So it lays out the people that they expect to be in contracts with. It lays out the new division within the Department of Health and Human Services that will be responsible for Medicaid. It lays out the new Joint Legislative Oversight Committee, which is a new joint committee between the House and the Senate in the North Carolina General Assembly that will have oversight authority over Medicaid. And it lays out the process for going forward in a transition. But there's still many, many details to be worked out about exactly how this is going to work, how we're going to move to value, how we're going to be measured on our quality and cost outcomes. All that is to be determined. So there's still a lot to be done. There's still a lot of conversations to be had. We'll be looking for your input in the coming days as session closes and in the coming months ahead to work with the new division, the Department of Health and Human Services, the Department of Insurance, and this new JLOC committee that will be organized at the General Assembly to encourage them on the new structure and how we're going to actually go forward. So the big takeaway is not that managed care is coming in, although this bill would open the door for managed care to come in. The big takeaway is that this is merely the first step. This is a framework for how we're moving forward, and how this is implemented is still yet to be determined. So you still have a lot of opportunity to bring your expertise to the table, to offer your advice and counsel about how we should take care of your patients better, and how taking care of your patients better can lead to better outcomes, not just for your patients, but for the taxpayers of the state of North Carolina. And we'll be looking to you for that help and giving you guidance for that help over the months ahead. So with the budget passing and Medicaid reform being announced, the end is near. We're close to the end of session. We would expect that it would end sometime within a week or 2 weeks. There are only 3 big items, big ticket items left. Medicaid reform, which has already been announced, the transportation bonds, which have been discussed from the beginning of session, and the incentives package, the JDIG, as is referred to down at the General Assembly, are the 3 big things that are left that shouldn't take more than a week or 2 weeks to wrap things up. So as the session ends, we'll be transitioning out of the legislative process into the administrative, going back to the administration and working more closely with them about the implementation of Medicaid and the programs that have been identified in the budget, as well as working with this new joint committee on Medicaid to talk about how we're going to go into the implementation phase of the Medicaid reform bill that will have just passed. So we'll be bringing you more information about how to stay in communication with folks about the details of how you should be taking care of your patients in the future. Again, we always look for your comments about how we're doing and things that we should be looking out for. We will be putting links on our website today and tomorrow that have connections to the bill, both the budget bill and the Medicaid reform bill, as well as short summaries of those 2 bills. Look to our bulletin next Wednesday for a more substantive analysis of both the provisions of the budget and Medicaid reform, and that will be right after it passes. Medicaid reform passes because it's not scheduled to be on the House calendar until the 22nd, which is next Tuesday. So until then, look to the website for more information. Thank you for joining us, and we'll talk to you again next week.